everyone. My name is Octavio Pontes. I am a titular professor of neurology at Ribeirão Preto Medical School, University of São Paulo. I'm also the editor-in-chief of the World Stroke Academy, and it's my pleasure to introduce you today uh, Dr. Christine Tunkl, she is a vascular neurologist of the University of Heidelberg in Germany, and she's also the first author of the paper of the month of the World Stroke Academy this month, Telemedicine Networks for Acute Stroke, an analysis of global coverage gaps and opportunities. So thank you so much for joining us, Christine. I would like to ask you first, what was the background? What was the motivation for this study?
Thank you, Octavio, for inviting me for this interview today and for highlighting the importance of our paper about telestroke coverage worldwide, the gaps and opportunities. So the motivation that brought us as a future leaders group to this project was that we all have the shared vision to make stroke care available for every patient, regardless of his geographical location. And we already have all the knowledge to how to treat a stroke with thrombolysis and thrombectomy and stroke unit care. But telestroke care is the way forward and the only way to expand our knowledge to every remote region and to treat every stroke patient, no matter where he or she lives, especially now in those times where everyone is connected with smartphones. So we know that telestroke care is as safe and effective as face-to-face treatment, but all the experience we have so far is from advanced healthcare settings in high-income regions. And other recommendations are from US, Canada, Germany. But now imagine that you are a policymaker or a stroke leader in a setting with good stroke care but less resources, and you want to set up a telestroke network. Where would you seek advice, and how would you set up your network? I experienced that personally some years ago when we thought of establishing a telestroke network in Nepal, a country with less resources than Germany. But they were on the verge to set up a telestroke network, but we knew we could not simply transfer our German system to Nepal. But there were no recommendations that covered the reality of a country like Nepal, a middle-income country.
Yes.
And that was when the idea came that we need global recommendations. And for that, we first need to understand how telestroke networks are working around the world and not only in high-income regions. And that was the beginning of our Future Stroke Leaders project on telestroke care.
Thank you so much. I was wondering, could you explain a little bit for us about the methodology that you use to collect this information?
Mhm. So when we started to think about how can we get the information from all the telestroke networks worldwide, we were actually quite surprised because there was no overview about the availability of telestroke networks worldwide. There was an overview from US and Germany and some European countries, but not worldwide. So before we could go into the details about the characteristics and the structure of the networks, we needed to understand where telestroke care is used worldwide. And for that, we used a four-tiered approach, using the power of our Future Stroke Leaders group. And in the first step of network identification, we contacted stroke experts we knew from our countries and neighboring countries we know, and asked them just for the availability or absence of telestroke networks. Then we contacted stroke societies and stroke-related societies and angels coordinators from other countries, also asking only for the absence or availability of telestroke care. To be sure that we have a comprehensive list, we now sent a survey to regional stroke societies, asking all members again to indicate which telestroke networks there are. And last but not least, we already had a comprehensive list, but that was then double-checked by international stroke experts. And in the end, we had discovered 254 telestroke networks, but we only knew that they are there. We didn't know how they operate. So we created a survey which consisted of 39 questions and asked for the structure, the setup, the technology used, the processes, also for perceived strength and barriers, for financial aspects, and last but not least, for key performance indicators. And this survey was then sent specifically to the network leaders of 254 Telestroke networks. And yeah, our analysis then focused on understanding what are the differences between the networks, what are the typical characteristics, and what can we learn from that.
Okay. Christine, can you summarize to us the main results of your study?
For sure. As I already mentioned, the main finding was that we were the first ones to create a comprehensive overview about availability of Telestroke networks worldwide. And we found 254 Telestroke networks, which are located in 67 countries. What was really striking is that from those 254 Telestroke networks, 74% are located in high-income countries. So there's a huge disparity in Telestroke care favoring high-income countries. And Telestroke care has not achieved yet to provide equitable access to stroke care around the world. So 74% are in high-income countries and the others are middle-income countries. There's only one network we could identify so far in a low-income country. We also identified that there are 58 countries worldwide which do not have any Telestroke services so far. And from those, now 60% are middle-income countries. And only 22% of the countries without Telestroke are high-income countries. So that underlines again the disparity. I didn't mention low-income countries so far because from low-income countries, we barely got any responses and any feedback on the availability. And that is presumably because those countries are known to have no stroke services in general. We know that from other publications. So we didn't get any feedback, probably because no one feels responsible for stroke care at all. So
Yeah.
that is the first key finding. But then also we asked about the characteristics of the Telestroke networks, and they have a huge variability. So some networks, especially in the US, operate with 70 affiliated hospitals, and they have more than 1,000 consultations per month. On the other hand, there are networks, mainly those established in the last years in middle-income countries. They have 2 connected hospitals and have like 50 teleconsultations per month. So that indicates that we need recommendations that depict the whole variability. And we cannot just have one recommendation that covers those spectrum of different networks. It was very interesting that we found that within the networks, which were established within the last 3 years, nearly all of them are in middle-income countries, especially in Latin America. So that really highlights that there's a huge need, demand, and interest to expand Telestroke more far than only in the high-income country and extend it to other regions of the world as well.
All right, very, very helpful. I was wondering if you have found any tendency to use mobile stroke networks, telemedicine networks in your essay. Have you found any tendency towards the methodology of telemedicine that is currently used in Latin America, for instance?
Yes, we found that especially from the networks which were established in the last years, a lot rely on smartphone-based technology. Some use specialized software devices from professional companies, but others use like commercial non-medical messaging apps like WhatsApp or Viber. What we do not know is if these networks perform on a similar level of outcome as those professionals having dedicated video devices. So that was another very important finding. We had asked for the quality performance of the networks, but we found that only 74% of all networks around the globe do any kind of quality monitoring, and 25% do not have any information on the KPIs like thrombolysis rate, door-to-needle time, or mortality. So initially, our hope was that we could identify best practices out of this survey. But as so many networks do not know about their performance, it's not possible so far to compare if simple WhatsApp-based technologies are as good, as safe, and effective as more advanced technologies.
All right. Well, Christine, thank you so much for this interview. It was very helpful, and congratulations for such a important effort. And it's an important topic, mainly to develop stroke around the world. Thanks so much for your time and disponibility to join us for this interview.
Thank you very much, Octavio, for inviting me. And I would like to extend those thanks to the whole Future Leaders group who was super active, to the network coordinators who were willing to share their insights into their networks, and also to the WSO faculty who made everything possible in this project. So thank you very much.
Thank you.